My name is Dr Catherine Bamford and I am a chartered clinical psychologist. I have my own independent clinical psychology practice based in Leamington Spa, Warwickshire. I provide psychological assessment and therapy to clients that are adults and children with a wide range of mental health difficulties. In addition, I also specialise in neuropsychological assessment and therapy for clients with acquired brain injuries. I developed an interest in psychology initially, having been inspired by family members who worked in the field of mental health. My interest in mental health grew further through volunteering for various mental health charities at school and university. After completing my undergraduate psychology degree, I gained experience providing psychological assessment and therapy to patients within the NHS in my role as an assistant psychologist. I found this work enormously rewarding and interesting, and it was at this point that I decided to train as a clinical psychologist. Patients often tell me that I'm easy to talk to and down to earth. They value the opportunity to be able to talk about their difficulties in a safe, confidential, and non-judgmental space. Patients also have told me that they value the psychological tools and strategies that I'm able to provide them with in order to help them overcome their mental health difficulties. Observing patients improve over the course of therapy and overcome their mental health difficulties is very rewarding. This can take anything from a few weeks to a few months, and in some cases years. But when a patient reaches this point, it is always a privilege and a pleasure. One of the greatest challenges as a clinical psychologist is that our work can be emotionally demanding, especially when we support patients that are extremely distressed or traumatized. An important part of our job, therefore, is protecting our own mental health so that we can be as emotionally resilient as possible. One way in which we do this is by receiving regular supervision from other clinical psychologists when we are able to discuss cases anonymously and provide support to one another in the work that we do. Another recent challenge in my work as a clinical psychologist has been managing the increase in referrals during the pandemic and learning how to deliver therapy remotely. Meeting this challenge, however, has been a largely positive learning experience, as I've discovered how effectively therapy can be delivered online. This has proven to be invaluable for some patients, especially during the lockdowns.